Magahagan Guahan, and Linda Pinco Denorsi, Director of Public Health and Social Services, Dr. Ricky Hernandez, Deputy Administrator of the Guam Economic Development Authority, as well as Dr. Felix Cabrera with the Physicians Advisory Group. And now Governor Leon Guerrero with her opening remarks.
Thank you, Janella. Have a day, and thank you for this opportunity to once again speak to you and to make some really good announcements today about where we're at with the pandemic. I just wanted to say that these 9 weeks have been really very hard, long struggle. It's been a journey that we all together took. And as a result of many, many initiatives that we had initially implemented real early on in this journey, very restrictive and very conservative measures that we have implemented and had mandated to you through executive orders. I just wanted to say that we are at a point now where we are going to start recovering. I also wanted to say that we wouldn't be in this stage of this long pandemic crisis if it weren't for your cooperation, if it weren't for the community support, if it weren't for your commitment to help save our people and to protect our people and to keep our people healthy. I also am very appreciative of the professionals and the experts that came together, and we created our response in a very methodical, very strategic, very scientific way. And we all work together so that we can continue to contain this virus. We created many things along the way to help us with this fight. We created our surgeon cell. I created the Physicians Advisory Group. I declared a public health emergency, and I just want to say public health have stepped up to the task. Public health is through their experts, through their competency, through their vigilance, and through their quick strategic decisions and actions. It's one of the reasons why we are here today. And what I mean when we say we are here today, for the past 2 to 3 weeks, we have been able to contain this virus. We have seen a path of this virus in our community spread that is very, very low. Some days we had no positives. Some days we had 1 positive. Some days we had 2 positives. But that is no luck. That is because of all the work that we have done. So since April 25th, we have been able to contain this. It's been over 14 days now. And when we started looking at recovery, as you know, we presented our recovery plan, which again was created by some experts throughout the whole community. Professionals, doctors, businessmen were part of it. And government officials and private sector, we rallied together to come up with a recovery plan, which I think is one of the best recovery plans throughout the whole nation and throughout the territories and the Asian Pacific region here. It was used and tailored after many, many good historical evidence from other countries like Singapore, Taiwan, South Korea, and also referenced by some good studies, CDC guidelines, and of course, President Trump's Open America Again. And so this recovery plan is very well thought out, very well planned, and we are now implementing this recovery plan. As a result of our scientific data, as a result of historical data that we have, as a result of advice from the recovery panel, as a result of many experts that have come together, I am now announcing that we will go from PCOR 1 to PCOR 2. What that means now is I am going to be lifting restrictions, and I'm going to be saying to you, you can now increase your activities in the community. I am going to be signing, or I've already signed an executive order, which is relative to declaring the pandemic condition of readiness, PCOR 2. And again, I want you to know that this is based on scientific data, and you'll see some information and you'll see some data from Dr. Cabrera that only also makes it much more confident that we go from PCOR 1 to PCOR 2. So what I wanted to say is, as a result of new data from Dr. Cabrera, I have decided, along with consultation from our experts, that we will be opening and lifting some of the restrictions to be effective on May 10th, Mother's Day, and happy Mother's Day to all of you out there. May 10th at 8 o'clock in the morning. So that's this Sunday. Want you to be able to prepare for these openings. And what we are lifting is more restrictions in the area of hold on, I'm just going to go my we're going to be lifting more retail spaces, more retail stores. We're going to be lifting shopping centers. We're going to be able to allow people to go and shop in the retail stores in the shopping centers. We are not going to be allowing in dining for restaurants. We are not allowing food court in dining also. We want to make sure that we can we want to make sure that we still have some restrictions on that, because it's very important to, again, continue social distancing. It's very important that we continue decreasing social contact. I am also allowing social gatherings of no more than 10 people. And social gatherings doesn't necessarily just mean your household family. It also means friends and people that you could gather with, but you have to restrict it to no more than 10 people. I am also going to be able to allow several services, professional and other services, not already allowed to operate during PCOR 1. These are like financial planning, advertising, marketing services, information technology consulting, photography services. We are allowing real estate sales to continue on to again be performed. We also are allowing automotive sales, detailing, and cleaning. Cosmetic establishments that provide beauty, barber, and nail salon services, flower shops, shopping centers, like I mentioned, also elective medical and dental procedures, treatments, and therapies. These are all also the guidelines for these are going to be up on the public health website. And so if you want to see the details of the operation procedures of these businesses, because they are going to be held to some preventive measures and some kind of guidance in terms of what activities and how they are going to provide social distancing in their facilities. Occupancy of 50% only for these retails. And of course, we encourage hygiene, cleaning, hand washing. Mask must be worn throughout this period, and mask in public specifically. We are also going to be allowing some government services that will be open in PCOR 2. We're going to allow services that do permitting and regulatory at Department of Public Works, Department of Land Management, Department of Parks and Recreation, Guam Environmental Protection Agency, Department of Agriculture, Department of Labor Unemployment Assistance, Department of Administration, Department of Revenue and Tax and Insurance branches, police clearances, and public health licenses and certificates. We are going to continue with, again, social distancing. We have been talking to our Archbishop also, and we are allowing the sacraments. We are allowing uh, sacraments to be done, but no more than 10 people during those services. We are also going to be able to open, like I said, elective medical and dental procedures and treatments. All those that have already been authorized under PCOR 1 will continue to be authorized. All the retail stores that we have talked about and all the other governments that we also had previously in our previous executive orders are also listed. We are going to ask you to continue on with your consciousness about social distancing. We are I just want to mention also that, like I said earlier, is to be able to go online to provide you with the approval of the industry specific guidelines. I just want to say public beaches and public parks continue to be closed, but only open for individual use for purpose of exercise, physical, mental, and subject to social distancing mandates. I know that's a lot of information to remember, but again, you can go to public health website to get that information. I also want to say that the triggers that are going to again be measured are the number of cases that we have, the capacity of the hospital, testing. We are able to do community-wide testing, and that's going to be very crucial and critical in making more of our decisions moving forward. And of course, contact tracing. So I am very confident that when we go into PCOR 2, we will continue to see the low numbers. But again, that will not actually happen if we don't continue on with the behaviors that we're doing now. We need to make sure that we continue on with what I had just said. Mask, social distancing, hygiene, washing your hands, be very conscious about social contact, be very conscious about exposure, and your community support and your behavior is going to be what's going to make us move on forward from PCOR 2 to PCOR 3. Again, I just want to say thank you for all that you have done in terms of working with us and battling this very invisible enemy of ours, coronavirus. Thank you. I'd like to ask Dr. Cabrera now to present his new data that we are also going to be using to make sure that we are in compliance. Dr.
Great.
Cabrera.
Thank you very much, Governor. While we're getting some slides up, I just want to say Happy Mother's Day, Mom. Love you. Okay. So these slides, as usual, are being made available to the media, and they'll be published, and they'll also be shared through the governor's social media sites. So first of all, just a reminder that the governor already had run through is triggers to inform a decision to move from PCOR 1 to PCOR 2. It's the cases, and in particular, it's a downward trend of confirmed cases and a downward trend of positive tests as a percent of total tests, or in other words, test positivity rate over about a 14-day period, and in doing so using a 5-day rolling average. And of course, the ability for the hospitals to take care of patients without having to resort to alternative standards of care, our testing capacity, so that it reaches a point and it continues to stay above a point where we can test everyone with COVID-19 symptoms. And then lastly, contact tracing, as the Department of Public Health has been able to do very well and have continued to improve their armament in that process. Next slide. So lot of my slides are busy. They're meant to be mostly self-explanatory on their own, but I'll talk through a few of them. So the first slide here is just an update of our hospitalized COVID-19 cases. As of today, there are 0. And the green line here is the new COVID-19 cases per day. As you can see, we've gone down a significant amount. And then the yellow line is that test positivity rate. So for that, we want to stay below 3%, and that means we're doing excellent. And going back to the new COVID-19 case number, if we stay below 5, we consider that a very manageable number. Ideally, it stays at 0. Next slide. Okay, and so this slide here kind of just summarizes the number of tests that have been performed on a daily basis here on Guam. This incorporates all modalities and available testing at different labs, as well as the tests that have been done off island as well. And so it's just a quick visual representation of the number of tests performed and the positive test results that we get. As you can see on the left, that's when we have more positives and less tests. And then as we move to the right, which is more current, we see a lot more tests and very little positive, which is exactly what we want. And that's the less than 3% test positivity rate that we want. Next slide. Now, this slide is a very busy slide, but really there's just one visual point that you should, that everyone can take home. You want to see green on the right, and you don't want to see that turn red in terms of the area of the graph. So this this graph combines both looking at the number of new cases and the number of tests that we're able to do per day, and uses a 5-day rolling average. And as you can see early on when it was red, basically we had too many cases for the number of tests that we were able to perform. And in that situation, it was difficult to control a pandemic in that setting. But as you can see here in the graph, we turned the tide, and then where we switched over, where we actually had enough tests to test for, and in terms of the number of positive cases that we had. And the beauty of this slide is that the scale turns out that this point where it meets, where the tide turns, is when the test positivity rate goes below 3%. And as you can see, we've been doing very well since the middle of April. Next slide. This is just to show how we compare to other countries. So you can, as everyone knows, Taiwan has done an excellent job in controlling their control of COVID-19 cases. Canada, United Kingdom, and Japan have not developed enough tests in order to manage the number of COVID-19 cases they're seeing on a daily basis. And so they're still working on that. Next slide. What's really a great comparison to see is that we're actually not too different than South Korea, in that South Korea themselves also had a red area on the left where they still didn't have enough tests to deal with the number of cases they were seeing, but their tide turned, and then they, as everyone knows, that they did a tremendous amount to improve their testing capacity, and because of that, they've been staying green for over a month, well over a month now. And so on the left, you can see how Guam, this is the previous slide that I had shown earlier. Next slide. So the next part here, I'm going to talk about Guam's mobility data. And so basically the question comes to is, how compliant have we been with stay-at-home orders over the past, going almost 2 months now? And what has that been, and what is that compared to pre-COVID-19 times? Next slide. So what you're seeing in this slide here is a representation of Guam's mobility data. This data was taken from, was actually provided by Apple, and where iOS devices or iPhones were in users who have their location enabled and had used Apple Maps, for example. It tracked their overall mobility. And in this setting, of course, this data is completely anonymized, but they set a baseline of 0%. And above 0 for that day will be the amount of activity. And then if it's below 0, that means that there's been much depression or suppression of activity overall. And so if it's negative, then that means that people have been basically staying home. And so as you can see here, this slide starts at in about the middle of January and then goes up until May 6th. And as you can see, the point where we actually went below 0% and started being negative was around the day of the first COVID-19 positive cases that were confirmed here on Guam, which was March 15. And basically, Guam has done a great job of staying around 50% or lower, approximately that in terms of decreased activity on the island. And that's been shown to be a great part of our fight against COVID-19. So the question is, how's this data compared to the rest of maybe the country or other areas? Next slide. So as you can see here, still in blue is Guam, and red is the rest of the country of the United States. In orange is Manila, and then in green is the state of Georgia. So this was seen here as a representation. Overall, with Guam, again, being blue, we are doing better than the rest of the nation and definitely better than Georgia in terms of our stay-at-home compliance and decreased mobility throughout the island. And then just as a comparison, Manila is here, and it shows that they're very strict compliance with their stay-at-home orders as well. And what I wanted to point out here was that, when you see, if you go back in the pre-COVID-19 era before we started staying home, the peaks that you see are weekend days. We see a very large peak in February 8, and just to satisfy everybody's curiosity of why that is, that was the same day that the Theodore Roosevelt actually docked here on Guam back in February 8, and apparently they had Liberty that weekend. So that contributed to the increased mobility on the island. Next slide. So this here is a slide that represents Guam's mobility in relation to the mitigation efforts that were done very early on, as we recall, the closure of schools and non-essential government of Guam offices, travel restrictions, especially with the first flight that was quarantined, the stay-at-home orders that were initially enacted, and then the closure of all non-essential services overall. And it shows where it relates in terms of the date. There's a reference line here of minus 50% just to see how our activity roams around that. And so you can see that it's been quite effective in terms of getting us to a better baseline. Next slide. So naturally, we want to look at how this relates to the number of cases, both new daily cases and hospitalized cases in terms of how well we've complied. And as you can see here, in this slide, that the purple representing hospitalized and green representing the new cases, it took about approximately 2 to 3 weeks for us to 3 to 4 weeks for us to fully suppress our cases and get us and really squash the curve down to a baseline where, as you can see, we've been doing very, very well overall. And in the overall mobility on the island has gone above 50%, and I think that's a correlation with the low number of cases that people have sort of started relaxing. As we move into PCOR 2, we anticipate that this mobility data is going to start going back up to the 0% marker, and that's okay. And it will continue to be okay as long as the cases remain flat and remain low. So in a good way to be a marker of how we're doing in terms of reopening Guam is that our mobility starts going well above into the positive, above 0%. And then we still continue to see a flat number of cases and of COVID-19. And then that's a good indicator that we're reopening successfully. Next slide and final slide. This is just a representation that in terms of the graphs that were just shown and how they relate to our own feedback in terms of the implementation of our measures here and the relaxing of restrictions, and how we're going to hold ourselves accountable and the rest of the island accountable for continuing to do an amazing job of adhering to the orders that our governor has given us, and with her leadership and with the tremendous efforts of public health and the rest of the frontline workers and overall healthcare workers as on Guam. And with that, that concludes my slides. Thank you.
Thank you, Dr. Cabrera. I just wanted to add that as a result of this data that Dr. Cabrera has just presented, which is very positive and very hopeful data, um, I know that we have said that May 11th will be the opening date of our lifting of our restrictions, but because of the data that we saw this morning, decided to open one day earlier and to be able to again share and enjoy Mother's Day with our family, and especially again make sure that we restrict it to 10, no more than 10 gatherings. I'd like to also say that one of the restrictive measures that we are going to continue is the inbound travel from other places. We will continue quarantining those people who do not have results or positive results. Those results that are negative within the 72 hours of testing. We will continue quarantining them, and that will remain till we probably move into PCOR 3. I would also like to add that when we open our government businesses, we are going to be staggering the government opening of those agencies that I had just mentioned. I'd like to now turn it over to Linda DeNorsi, who will give us an update on the COVID situation. Thank you, Linda.
Thank you, Governor. As of today, we have 151 COVID positive cases. And in that breakdown, we have 127 that are local, 14 are U.S. Naval Hospital, that all the tests are done through the Department of Defense, through the laboratory in San Diego. And 6 cases have been confirmed by Diagnostic Laboratory Services, and 4 are probable cases. And that's how you get that breakdown all the way to 151. We definitely have our website, www.dphs.guam.gov, that has all our dashboards, and you can see the map that has every single villages and the number of positive COVID cases that you have in those villages, as well as the recovery of those individuals. I also want to emphasize that of our 151 cases, we currently have ones that are no travel history of 132, and that breakdown is as follows. 38 are household contacts, 14 are community contacts, 19 are healthcare contacts, and that's broken down further with 5 as patients, 14 as healthcare workers, and 61 do not have any reported contacts. In regards to our quarantine site, as the governor had indicated, we have continually 194 individuals still in the government of Guam quarantine. Those that have already been completing their 14-day quarantine amounts from the time we began our quarantine on April 2nd all the way to the current, we have 567 that have completed. In regards to our recovered COVID cases, we have 123, and of that 123, we continue to provide contact and continue follow up with those individuals. Thank you, Governor.
Thank you, Linda.
Okay, and we'll now open up the floor to questions, but just as a reminder, we are going to have 2 rounds of questions. The governor will make herself available for the first round. So we just kindly ask that the first round of questions be directed to the governor, and that you reserve your questions for the rest of the panelists to the second round. So we'll begin with PNC, Kevin Kerrigan. And again, please regulate your microphones, your individual microphones, so you can go ahead and unmute yourselves and then mute yourselves after you're finished with your questions. PNC, Kevin Kerrigan.
Thank you, Janella. Good afternoon, everyone. This is a question for the governor. Slide number 6 in the road recovery presentation given by Ricky Hernandez yesterday, and I think by somebody else last week. There's a second tier of businesses, Governor, that you briefly mentioned in your opening remarks. Those are the bars, gyms, parks and beaches, clubs, sit-down restaurants, and according to that slide number 6, they will be under review. Those businesses and activities will be under review in PCOR 2. So my question is, what are the factors that will allow those activities and businesses to reopen? When can we go back to the beaches, parks, and sit-down restaurants?
Right.
What will determine that?
Thank you for that question, Kevin. When we lift the restrictions, what we will be doing is, again, continuously monitoring and testing. So we will be using that data to look at what is the behavior of our community out there. And of course, with the tracking of this new mobility application that Dr. Cabrera is now using, that is a good way also to measure, are we adhering to what we have to do to prevent the increase of COVID cases. So as we move along during the week there, Kevin, I'd be looking at, well, how many positive cases are we going to be seeing? I'm going to be looking at what is our testing capacity. I'm going to be looking at what is our hospital capacity. I'll be meeting with the hospital administrator to give me information about what is the census for COVID patients. Because we want to make sure that we can we have the capacity to treat our COVID patients if we start seeing surges. That's what I'm concerned about. As we lift things, some people continue out there in their business, and we've opened retails. People are now coming and having more social contacts with people. This is going to be a little risk. And when we monitor that and we look at, well, what are our numbers saying? And we continue to see the low cases, and we continue to be sure that we have enough testing, hospital capacity, and contact tracing, then we can start opening back up those businesses. So I'm looking at reviewing it within 1 to 2 weeks. The period that you are is guided about how long do you become PCOR 2 and when do you decide to go to PCOR 3 is really 3 weeks or I think 28 days of low cases. But if our numbers continue to be good, my recovery panel of advisors will review and will advise me as to should we open more or not. So it's very crucial that we as a community continue on with our distancing behaviors so that we can really get out of this, Kevin. So as long as we have the low numbers, then I'd be more comfortable to, again, open up more new businesses and services.
Thank you, Governor. And my second question has to do with the double pay issue. As I'm sure you've heard, Senator Josanne Augustine has raised this issue about double time pay for essential GovGuam workers. The Guam Federation of Teachers is now threatening a possible lawsuit against GovGuam over this double pay issue for some frontliners. What is your position on this double pay controversy?
Our position is that, first of all, the people that are working are already getting differential pay. So if I was going to say we need to compensate our people for the risk that they are incurring as a result of the COVID and they're out there in the community, we have this differential pay to help with that compensation. Additionally, the double pay, as I understand it, really goes into play if the people that are at home are on administrative leave, but they are not on administrative leave, they are on regular work, because we have to make sure that if we need them and we give them a 2-hour pre-warning of coming to work, that they come to work. If they are on administrative leave, we cannot really interfere with that administrative leave. So double pay and administrative leave sort of kind of go hand in hand. I am not supportive of the double pay because we already have the differential pay that we are giving to compensate for these individuals. And most especially, Kevin, double pay, I cannot afford it. I cannot afford to pay double pay and differential. So it's more a issue of fiscal responsibility. I think it's also an issue of what is it that we can afford. And frankly, I cannot afford double pay again with the differential pay.
Thank you, Governor.
Thank you, Kevin. Next is PDN, Steve Limtiaco.
Yes, hi, Governor. I just had a question about what happens with daycares. I mean, those are kind of important if people are going to go back to work. So when's the soonest those could reopen?
Yeah. So daycare also is a concern because, as you know, it's a congregate place. And we have seen where there are positive cases in daycare situations. So the more I am confident that we have less and less and less community infection out there, I think the safer we will be to open up the daycares. So right now, daycares are not part of it. We could probably look at it in PCOR 3. But right now, because of my concern about the safety and the health of our community, daycares are not on the list to open.
Okay, and as a follow-up, PCOR 3, that won't happen for 28 days, correct?
Yes. Yes.
28 days from
That's
this,
the guidance. It's a minimum of 28 days.
but you're not willing to you know, break that policy at all for any businesses?
Sorry, what
Like-
was your question?
You're not prepared to deviate from that policy and maybe open up some businesses sooner than 28 days?
Yes, and that was basically Kevin's sort of question about how am I going to review so these other businesses can come forward. So all of our advisors will be looking at that, and I'm going to be guided by the advisors, and they're going to be guided by the data that we're seeing, and like I said, by the 4 criteria if we continue to meet them. So to your question, yes, we could open some of these business before the minimum of 28 days.
Thank you, Steve. Next is Mariana's Business Journal, Wayne Chargaloff.
Hello, Governor. There are a lot of businesses that need to renew licenses and meet other regulatory requirements. And even with government agencies reopening, there are still limits on their operations. As more and more businesses begin to look at reopening, what measures are being taken to facilitate regulatory compliance while still adhering to PCOR 2 restrictions like social distancing and that kind of thing?
So we are going to be opening our services to the public for business licenses and so forth. And we are making sure that the workspace is adhering to social distances, and for people that are, customer to customer related, we're going to make sure that mask, and also I think we are reconstructing the areas to have plexiglass. And I was just at DRT, and what DRTs, they're not opening there because they're not yet ready, but they are going to be opening at the one-stop center. I think they're going to be there, and also a driver's license satellite they are going to be opening. Plus DRT has extended business licenses to May 31st.
Thank you. And in a prior press conference, you mentioned a third party would be brought into audit. This is regarding disbursement of federal pandemic funds. Has that third party auditing party or firm been identified yet? And if so, who are they?
No, it has not.
Do you have a timeline as far as when they will be identified or brought in, or?
No, there is no timeline, but we are going to competitively RFP it out, and we are doing that, Wayne, because we are an administration that's very much transparent. We are an administration that's very accountable. We are an administration that we give a lot of public information out. We are an administration that continue to communicate very closely with the community through press conferences. We are an administration that can be trusted. And so one of the ways that we are going to assure our transparency is exactly getting a third party to come in and look and see how our controls are, look and see what our processes are, and help us along to be much more adherence to processes and so forth. And so, again, we don't have a person or an entity or a firm that we have already offered. We are writing our scope of work, and then we will competitively bid it out.
Thank you, Wayne.
Thank
Next is Pacific Island Times, Johanna Salinas.
Half a day, everyone. Okay,
Cover
so
Johanna.
hello.
Hi, yes, we can hear you.
Okay, just checking. All right, so my first question, since the resignation of Tony Babauta, we have not heard of the circumstances behind his resignation. So was he asked to resign, and will he be asked to reimburse the government for his hotel's expenses?
So Tony Babauta tendered his resignation, and I accepted it.
Okay, so will he be asked to reimburse the government about the hotels?
We have not had any discussions about that, but again, he is no longer with this administration.
Okay. So my next question is, do you feel like there is a growing rift between the executive and legislative branch? Like, do you feel like there is a mistrust or a level of mistrust in the administration on the part of the legislature?
I don't feel that at all. I feel that there are three equal branches of government, and each of these equal branches of government were created to assure checks and balances. And we in any kind of government, there are going to be debate, and there are going to be disagreements, and there are going to be discussions. The speaker and I have a very close communication. I meet with her on a regular basis. I meet with the Chief Justice, the speaker, and myself every Monday, and we talk about the COVID situation, and we talk about measures that we're putting on. The speaker provides me with information. I provide her with information. Additionally, every Friday, my policy team meets with the senators in their caucus. So at that time, information again, questions are asked. So there is close communication with the legislators. I do believe that as a result of that, we have closer communication, and there's a sense of more relationship and ability to debate and discuss issues and ideas. That's how we can improve policies.
Okay, thank you.
Thank you, Johanna. Next is Guam Daily Post, John O'Connor.
Thank you. So this question goes back to the some of the prior economic reports, as well as the special economic surveys that occurred yesterday. While it seems we could certainly use more concrete numbers, it appears that the early indications show we are heading towards a recession.
John, you're muffled, and I cannot hear your question.
Am I still muffled?
No, much better.
Okay, thank you. So again, this goes back to the prior economic reports as well as the SES that occurred yesterday. Early indications show that Guam is heading towards a recession. And I believe during the SES yesterday, it was stated, someone had cited a report, not specific to Guam, but in general, that tourism numbers won't rebound back to 2019 levels until 2023. So, Governor, how does your administration plan to mitigate the effects of a recession if it comes to that?
Right. In our government and in our community, there are several ways of providing revenues and income to the government and even to the community. One is, of course, tourism. The other one is military spending. And the third one is local government spending. And so, yes, the tourism numbers are, for all purposes, zero. And so, yes, we have to work very hard. There is a group in my economic council, and I have solicited the expertise of many, many people to include Governor Carl Gutierrez, who is my executive. He's my advisor, and there's plans to provide a tourism recovery program plan. And these are going to be experts in the tourist industries, because we are, of course, very concerned, and we want to really bring back our tourism, but we can't bring back our tourism if we don't really take care of our COVID crisis here, if we don't have people healthy and safe in a community. So you are right. From what you're reading in literature, I don't know if 2023, what we're 2020, I would say maybe 18 months to 2 years, we are going to invest back to build our tourism industry. Additionally, John, what is going on here is every state, every nation, every country globally, their economy is, for all purposes, flat to zero. And so, what has happened with with the United States, Congress recognizes that, the president recognizes that. So they are doing and putting and investing a lot of money in all of the states, not just to help our people, but to try and bring back the economy. And for Guam alone, you will see in these next few months an infusion of close to $1 billion in financial aid. And that will help contain some of our economic activities, but we cannot rely on that. So, of course, we have to work very hard to bring back our tourist industry. And also, this is a good time to look at other diverse economic industries. Primarily, that I'm looking at is agriculture and aquaculture and telecommunications, which are industries I think that are very feasible for us to grow and expand. So the economy is a concern. I feel that once we get our plan together, I feel that if we work together as a community, that we will rebound back to our economic well-being. And also, it depends also on a global perspective, right? If people do want to travel and if people feel comfortable that they will not get infected with the coronavirus. And so it is going to be a wait and see game, but we are continuing on forward to creating our plan to make sure that our tourist industry is revitalized.
You are correct, Governor, in that it would depend on how other markets also react to COVID-19. I'm not sure. Are you hearing anything about how our Japan or Korea might begin to have tourism back online? Or what are you hearing regarding that?
Well, Japan is still trying to stabilize their coronavirus crisis because, as you know, they got reinfected and again became a hotspot. I do know that Taiwan I just was in a conference call with the Taiwan Adventist Hospital, and they were presenting to us their numbers. And Taiwan, which is 23 million people, they only have 436 confirmed cases, and they only have 6 deaths. So if you follow the global picture, people are looking at Taiwan in their ways, the measures that they put in, because they have been very successful in containing. The key for Taiwan is because they were they experienced SARS, and they really were very much devastated with SARS, that they prepared themselves, and they prepared themselves so well that even before anyone else shut down and locked down, they locked down. And as a result of that, they were able then to contain the virus crisis. Taiwan, I'll tell you, the whole country or island is open, but they are not opening for foreign people to come in. And if you do come in, returning residents or so forth, they also are required to quarantine for 14 days. So even with them, who are very low, who did the right things, who didn't really have a surge, they're still very, very cautious about travel and about being reinfected. So I think if we were going to see some travel, I would probably think South Korea might be the first market. Japan might not be yet ready because, again, their government isn't doing well to also their economy. They have canceled the Olympics, which is a big blow for them economically wise, and they're still battling the coronavirus.
Thank you, John. KOAM, Nestor Lecanto.
Thank you. Good afternoon, everyone. Thank you, Governor, for the Mother's Day gift for the island.
Oh, you're welcome. Make sure you bring your mom some flowers, Nestor.
So first question, Governor, is so PCOR 2 obviously will rely heavily on the businesses that are reopening to sort of police themselves. I was wondering if you could comment on that. And do you expect or even encourage maybe citizens to report possible violations themselves?
That's a very good question, because, public health can't be policing them as much as we would like it. And so a lot of this, Nestor, in opening is a lot of trust in our community and a lot of trust in our business community. And I'm confident that our business community will not jeopardize or risk any more of this coronavirus infection. And so they will self-regulate and self-police themselves. I also think that people will also do it, only because they also don't want to have to again start all over with this battle of reinfection with coronavirus. So I am very confident. I'm comfortable that our community will step up like they have, and especially the business community. I've been meeting with them, and in fact, when they put in their guidelines or their standard of operations, they are so detailed to the point that when they were talking about credit cards, they are only allowing one person to deal with the credit cards, and they're talking about one person opening the doors. They're talking about making sure that they have the 50% rule being made, and so they'll restrict people from coming in, and they can only come in if people come out. And we're already seeing that with the grocery stores and other places. So I'm very, very impressed, and I'm very appreciative of the way the community's responsibility is to protect our island.
All right, Governor, the second question is, I think pretty much everyone is expecting a pretty severe economic downturn. Businesses and individuals will likely be looking to tighten their belts. Will the government of Guam lead by example and start cutting back and downsizing?
You know, we have talked about this, and this is our time to look at what we can be and can do for in terms of efficiency and effectiveness. So we're not in it's not a major attention right now because we are involved with all these other issues, but we have started looking at what we can do to make a more efficient government.
Thank you, Nestor. From the Point, Nick Delgado.
Half day, everyone. Half day, Governor. Happy early Mother's Day to you.
Thank you, Nick.
So while we all hope to continue to see the zero to low number of positive COVID cases in recent days, or what we've seen in recent days, aside from those triggers that you listed, what would be the deciding factor that would force you to revert back to where we are now? For example, would it be 5 or more new positive cases in a single day, or more people getting reinfected? And also there's still some concern that since Guam is not completely COVID-free, that we should wait to reopen.
I don't think, I think this is a very prime time to reopen because we have met all the criterias that we have set and we have had data. Actually, I've been tracking the data since we peaked and we started decreasing in our peak by say April 7th, April 8th. And we've been getting really good data as a result of that. So I think this is a good time to reopen our businesses. And what was your first
The first
question?
part, sorry
Nick?
about that. The first part has to do with, aside from the triggers that you listed
Okay.
that we're monitoring, what would be the deciding factor that would force you to revert back to where
Right.
we are today?
So of course, cases is important. And when we start seeing surges, and I know that Dr. Cabrera has looked at 5 days, 5 rolling days of the number of cases, because you know you could have number of positives up 5, and then the next day it's down to 3, and then 2, and you know there's this kind of roller coaster thing. So we're looking to see about what the 5-day average rolling average would be, and we're looking at the positive cases of 5 and under. So once we start going above 5, say 6, 7, 8, then that's going to be a grave concern for us. So that would be one of the triggers. Additionally, if we see that the mobility continues to go up, you know, people start being more mobile and we start seeing increase in positiveness, then that's saying to us that, you know, we need to start looking at putting back some of the restrictions to, again, control the mobility and the activities, because as you know, once we become much more mobile, we have an increased risk of contact and transmission of the of the virus.
All right. Okay. And so earlier to Wayne's question, he had asked about the third party getting involved. You said that the administration is transparent, accountable, communicates closely with the community through press conferences, and can be trusted. And that you said we will get a third party to look to see how the controls and processes are, and that you are writing out the scope of work, then will competitively bid it out. My question is, how would you then do a competitive bid when the government is currently not publishing requests for proposals because of the suspension of the open government law?
Okay, so it's not that we're not publishing requests for proposals, is we haven't really gone out for any requests for proposals because we were using emergency purchases as a result of what we need to quickly do to make sure that there are quarantine facilities, to make sure that we have the personnel that we need to run those run those quarantine, to make sure that we have the necessary PPEs, to make sure we have the necessary testing, to make sure that we have the necessary personnel to do contact tracing, to make sure that the hospitals are equipped with what they need to do. So in order for us to do that, and that's why there is a declared public health emergency, and that's why the senators, in their wisdom, have passed the Public Health Act, which gave me the emergency powers to do emergency purchases. So it's not like we're not sharing our RFPs. We just really haven't had any RFPs, to my recollection, that has gone out there.
Thank you, Nick.
Thank you.
I-94, Adriana Cotero.
Hi, everyone. So for my first question, KUAM obtained documents through a FOIA request that shows the Department of Integrated Services for Individuals with Disabilities, or DISID, hired a deputy director for almost $80,000 a year last week. Now, this position hasn't been filled in decades, and DISID has not been open since March as part of your non-essential GovGuam agency closures. Your policy director, Carla Branch, had also told KUAM that the new DISID deputy, Michelle Paris, is working at GovGuam quarantine hotels, where she makes an additional 15% on top of her salary. So how do you justify filling this non-essential political hire position, or if you could just explain it, especially while thousands in the private sector have been either laid off, furloughed, or had their hours cut?
So my recollection is we hired the deputy of DISID before the COVID crisis. We hired the deputy director of DISID because we needed to have that position. We needed to have that position to provide the services for individuals with disabilities. We needed to make sure that we have the necessary operations to provide for our individuals with disabilities. We wanted to make sure that individuals with disabilities are given the vocational training so that they can be self-sufficient and so that they can provide for their own self-reliance and self-sustenance. So my understanding was this position has been filled before even the COVID virus. So I don't know what document you're looking at, that it was just recently hired, because I have my recollection that this individual, I know because I interviewed this individual since last year. And I think I'm not too sure whether we hired this individual in December or January, but it was definitely before March 14th.
Well, the document I'm looking at, it says effective date was April 13th. And this is a FOIA request from the Department of Administration.
So I don't know what document you're looking at. I don't know, are you looking at the GG1? Are you looking at the personnel action document?
No, as I said, our FOIA request that we had put in.
So
that's what I'm looking at.
need to know what document you're
it's a
referring to.
personnel action.
Yeah, so my recollection is it was hired, the individual was hired before then.
Okay. Okay, well then for my next question,
It may be a processing thing, you know, I don't know, but I do know that we made the decision to hire the person because I was involved with Phyllis in hiring that individual. So it may be a process thing. I'm not sure.
Okay, so to clarify, you
Adriana.
said that you did the interview a year ago and that this person was not just hired last week.
No, it was not hired last week. It was hired before that process date. Yeah.
So for my next question then, I'm sure you're aware that MedFarm warehouses on Guam and Saipan were raided by federal law enforcement officers this week for having alleged fraudulent COVID prevention items, this being the SDS blocker for sale. And the company released a statement yesterday saying that they have removed the items from their stock after the raid, but they also said they had received the supply from a local Guam distributor. Was the state surgeon cell notified on the matter, or do they or you have any additional information on who this local distributor is? And if you could also, what's your message to companies who are bringing in fraudulent items during this public health emergency?
So I don't know if the state surgeon was aware of it or reported. I mean, I was not aware of it even till the day that it happened, and I read it or heard it in the news. And but I do know that the federal government, and I know this because this is discussed in our NGA meetings and also with the president and the vice president, that they are very concerned about counterfeits. That's their main concern. And the reason for that is because of the safety of our people. For example, if you had a counterfeit test kit and it's showing false negative and we don't know that, and we continue on thinking our island isn't infected when it is, that just makes it worse in terms of safety in our island. I don't know who the company is, Adriana. I don't know who they are. But again, this is why I am also very adamant about test kits that come in, and that it has to be FDA approved or EUA approved, because that means they've been vetted, and that means it is official, that means it's accurate, that means it's of quality. So this is why when leaders tell me to use test kits, and we research test kits, and the test kits do not have FDA approval, then it concerns me. It concerns me because, again, it's all because of the safety of our people. So I do know also that because of their focus in making sure to protect the community, the FBI here, the federal government, has been investigating those kinds of situations.
Thank you, Adriana. And again, we did give one round of questions for the governor, but the governor does have to be somewhere. The remaining
So I just
panelists-
want to say, excuse me, I just want to say thank you very much again to the community. Our success and where we're at in terms of protection of our people would not be without your support, without your commitment. And I ask again for your patience. I ask for your persistence. I ask again for your passion and in an island that we can feel like we have COVID, minimal COVID infection, and hopefully not have any reinfections. So I ask the public that as we lift these measures, to please make sure you continue to adhere to social distancing and making sure masks are in place. Follow the rules that the retail companies will be doing in their places. And again, if we don't really have to be out there, let's think about that and be home with your family. And also, social gathering is no more than 10. Thank you, and Sidus Mase.
Thank you, Governor. Linda, would you like to move to the middle, or go ahead and, or maybe Ricky can move down one seat, just so we don't have an empty chair. Okay, so for the second round, we'll begin once again with PNC Kevin Kerrigan. Kevin, are you still there? Okay. I think Kevin might have left. We'll go on to PDN, Steve Limtiaco.
Yes, thank you. I have a question for Mr. Hernandez. Could you tell us more about the $20 million in business grants? How that's supposed to work? Is there a cap on those grants for small businesses, and how is it first come, first served?
Yeah, so GITA currently working on the guidelines, and that should be released hopefully in the next week or so. But we're ensuring that we're trying to divide that up to as many businesses as possible. I think there is a focus on small businesses as well. But once we get those guidelines out, once we finalize those guidelines, we'll let that out and to the widest the widest network possible.
Just as a follow-up, in general, can you say anything about like which businesses might be eligible or ineligible for this money?
Yeah, I mean, it's still kind of in discussion, but we're wanting to ensure that, like I said, we're trying to get as many businesses the amount of money as possible. We don't want to target a grant, and so these are grants, and we don't want to target grants that are too large that it doesn't provide cast a wide net. But I don't want to prematurely mention what we've been in discussions in terms of distributing those funds. But that's in the works, and we're working as fast as possible to get that out.
Okay, thank you.
Thank you, Steve. Mariana's Business Journal, Wayne Chargaloff.
Hello. Can we get an update on the island's testing capacity? How many people a day can we test right now, and how far is that from the island's target testing capacity?
Yes, I'm going to speak on behalf of our Department of Public Health. Currently, as you know, we have several machines. We have the ABI 7500 machine, which is a PCR, a polymerase reaction chain reaction machine. We also have the Gene Expert, which is also a PCR. And then we have the Abbott ID Now, which is all in operation. I just want to share with you that through our outreach, we were able to get a maximum test done within a day of 246. So again, it's going to be dependent upon how many people come in and how many testing is done. But with those 3 machines, we ran them all simultaneously within one day, and we were able to do 246. Now, how soon can we continue? We are continuing our efforts to move along in our outreach, and we're still working on all those congregate buildings and housing areas that are where high-risk individuals reside. We're furthering our journey through the first line responders, and as we continue our journey, we want to test as we speak, not only just the fire department, the police department, but also the emergency responders like the Army National Guard, and we already have about 200 plus of those individuals that are ready to be tested. And again, we're also utilizing the resources we also have through DLS, and DLS has been very gracious to assist us in this effort. And you recall, if we have 246 of our capacity at just the Department of Public Health alone, plus DLS can do about, I would say 100 to 200 specifically on average, we were looking at about 100. Then we have that capacity of about 346 just within DLS and the Department of Public Health. They do a BDX machine, and that test result is also done within 24 hours. And again, with the capacity that we'll also have with GRMC, and GRMC also has a Gene Expert capability, and they also have a BDX, and Dr. Cabrera can chime in and say further than that, but I think our capacity would be greater than our target of our 258 plus machines in one day.
Yeah, the only thing I'll add to what Linda had just mentioned is that actually U.S. Naval Hospital Guam as well in their lab, now not counting the sailors from the Theodore Roosevelt, but in general, they do their own tracing and they do their own testing, and those results are being reported to public health as well. So we add their capacity to it all. And so I at least from the numbers that we were able to extrapolate from even the JIC reports, that on May 1st, there was a combined total throughout the whole island of approximately about 268 tests resulted in that one day. And so a few of them may have been done the day before, but they were all resulted on that exact same day. So clearly breaking the threshold of 258 altogether.
Yes, and in line with the capacity to continue the testing is also because we're getting the capacity to get more supplies of testing supplies. As of today, we have our schedule of what we're going to get from US CDC through the IRR for our Gene Expert machine. We're getting weekly tests that are going to be brought in, test kits specifically amounting all together, including the Abbott ID Now, about 5,000. Our journey to continue increasing the capacity for testing is also involving our partnership, not only with DLS, but we're also moving forward with a project that we're fine tuning. We're just getting the MOA finalized. And what we're going to be doing is working with UCSF and also the University of Guam. And we're going to be launching the ability with the recovery team that is part of our governor's team, along with the Department of Public Health, to join efforts to increase further the capacity to test through another machine called a Roche machine that we're trying to get through this partnership that we're having with UCSF. And in doing so, we would probably get 2 more Roche machines that has the capability of conducting 1,000 tests per day. And that's 2 machines.
Thank you. And when people talk about a potential second wave, as far as worst case scenarios like field hospitals and that kind of thing, are those resources ready to go? And if necessary, how quickly could they be employed?
In terms of for the field hospital, so the only thing that so a lot of what we have done was the planning for readiness, and the reality is that we right now are pretty comfortable with where we are, of course, and which is why we're opening. The main unknown factor is how what's going to happen after we start opening, and we've mitigated as much as we can as we move forward. Now, if it does hit and we're hit with a big wave, we do have the additional capacity, especially with our counterparts, especially from DoD, Department of Defense, who have committed to assisting us if requested. So the big part of that is really requests for personnel first, so healthcare workers, and in terms of helping satisfy the bed need, even just within GMH by itself. But aside from that, I can't really comment too much more because that's there's many other pathways that goes by. But it's a pretty comprehensive plan that's already in place, and it's based on different triggers about that has to do with staffing levels as well as bed capacity together.
Thank you.
Thank you, Wayne. Pacific Island Times, Johanna.
Hello. Hello.
Hello.
Hi.
Okay, so my question is related to the people who got tested negative. For example, teens or adolescents, if they got tested negative around April or May, do they still have to get tested again before they start the school year?
I can answer that question. As far as the testing that is done, we want to make certain that the test for COVID, I think that's what you're implying. Is that what you're asking? Because there's so many tests that we give for school entry, such as a PPD skin test. So I just want to make sure the question is related to that.
Yes,
Usually
yes, the
PPD
COVID.
skin test before they go back to school. Is that the test you're talking about?
The COVID-19 test.
Okay, so the COVID-19 test, if you already had the test, then there shouldn't be any reason for you to have another test if it's negative. Now, if you convert from being negative and you experience some symptoms, then it depends when you're going to get the test again. We don't want to give the test too early because it could be a false negative. Usually the virus will develop, and we usually do it after 10 days. Remember, again, the infectivity rate of the incubation time is 2 days to 14 days. So I would wait, and if they experience symptoms, and of course test them again. If they test positive, then of course we recommend at Public Health, in order for you to go back to school to be completely cleared, is you get 2 negative tests again. So we just revised our policy again to make certain that they fully recover.
Yeah, and I'll just add too that the recovery plan indicates that K through 12 schools as well as higher education institutions are expected to be opened in PCOR 3. So there's some time. I guess the thought was that through summertime, we'll see how everything goes, and hopefully by the end of that, and when the next academic year begins, that hopefully can kind of fall in line concurrently.
Okay, thank you.
Do you have a follow-up question, Johanna?
No,
Okay, thank
that's
you.
all.
Guam Daily Post, John O'Connor.
Yes. Am I coming in clearly?
Yes, you are.
Thank you. This question is for Linda. Linda, earlier today you had the oversight hearing with Senator Terlahi and Senator San Augustine. During that hearing, you made some statements about concerns you've had regarding compensation for your staff, including the nurses. Can you elaborate on those concerns? Do you believe that your staff are not being paid adequately?
Yes, those are concerns that we mentioned during the hearing. It's because the executive order is clear that it's specifies that it's for non-exempt employees. And if you, as you know, and a non-exempt employee is anybody with a pay grade below K. Exempted employees are pay grade K and above, and that would most likely include the registered nurses. And so we have, as you know, lots of nurses that have been involved in the COVID-19 response, and we're very concerned that these nurses will be adequately paid. And so, yes, the senators asked me what other budget that you have or any projection in the future that you can request local funding for, and we stated specifically that we just want to make certain that all individuals that are working for the COVID response, whether they're public health employees or other employees from the other government entities, such as the Guam DOE nurses or the Guam GCC nurses and anyone else, that they be compensated accordingly. And so that was the reason why I brought up that the staff should be duly compensated, not only the nurses, but other staff that are exempted. And also looking at overtime pay for those that work beyond the 40-hour work week.
Just to clarify that, Linda, as of right now, you don't believe that your staff are being paid properly? Is that the case, or am I misunderstanding?
I'm trying to say that we're just following what's in the executive order. And I know that our timekeeper has prepared several of the timesheets that are already went out, and we're really going to find out today because we're supposed to be paid for the differential pay. Nobody has gotten paid yet. I'm promised that it'll be today. So we will be able to know how many people have gotten paid, whether it's the 25%, 15%, or 10% payment.
Okay, so for my second question, Linda, what did you mean by nobody's gotten paid?
Prior to today, yeah, today they're gonna get paid. In terms of the differential pay, everybody's been getting paid for their regular pay. I hope that doesn't confuse you. They've been getting paid regularly on the regular salary, but not with the differential, and that's supposed to be given today. I hope that clarifies things.
Yes, it is. Thank you, Linda.
You're welcome.
Thank you, John. And Nestor has asked that we skip him for this round. So we'll move on to the point, Nick Delgado.
Today. So do we know how many checks were released today? The first of the Programa and Salapi at Zurani Tautau, and a clearer date when the first batch of the economic impact checks will be released next week?
Yes, that's a very good question. As you know, the disaster relief program, the program Salapi Azudan Itautau, which translates to the program of money that is to help the people. So luckily I know tomorrow. At any rate, the eligibility benefits are also submitted, and I am promised that it will affect 17,000 households under our SNAP program, which translates to about 54,000 to 55,000 people. Now, that check is to be dispersed through the Department of Administration. And as far as how many checks went out, that's not in my department, but you can divert that question to the Department of Administration and they'll give you the appropriate answer in terms of your response.
And for the economic impact checks?
For that question, Nick, we'll have to get back to you because that's also
okay.
a DOA response. So we'll
And this,
get that answer to you as well.
Wonderful. So this next question is also for Linda. I know that the governor said earlier quarantines in the hotels would remain in effect possibly until we hit P-Core 3. But I was asked to share this from Mary Matinani, who Linda, you might recall as Kyla, you referred to her.
Yes, Kyla,
Well,
Kyla. Yes, that's
she's
my
been in Maui with her son,
former
daughter-in-law,
nurse.
and grandchildren
Yes.
since January. The trip was only supposed to be until March, but she's still there because she worries about what could happen if she comes home and stays in the quarantine sites. The retired public health nurse is not asking for any favors, but is pleading with both the governor and yourself to see what you can do to ease up the travel restrictions for returning Guam residents so they can quarantine at home. For those like Mary who don't have symptoms and can't get tested, has there been any recent discussions to ease those restrictions sooner? And also she asked, is there an option to do rapid testing as they arrive at the airport?
Yes, those are very good questions. I know that came from Mary because she's very full of questions. Anyway, as in regards to that question, we are concerned that any passengers coming in, the ability for people to quarantine not at the quarantine facility would encompass those specifically that are non-residents, specifically those that are coming in if they have a 72-hour test that is done prior to their arrival, then that will exempt them from being quarantined in a government facility, but that's not to say they can't still be quarantined at home. When we first started this pandemic response, we originally started where patients are being quarantined and they have a voluntary quarantine agreement. They can quarantine at either home or they can quarantine in a government of Guam facility. Now, when times continued and we started seeing more passengers coming in from the Philippines, this was the time where we knew that our infections were all coming from the Philippines. So Philippines was a hot zone. And because it was a hot zone, we really had to take all the passengers there and put them in a government of Guam quarantine facility. However, during this time, the Philippine government was trying to close all their airport. And we had a lot of our local people that just came from St. Luke, and some of them also experienced some type of a medical treatment. For example, they just underwent surgery and they were not very comfortable because they'd be more comfortable being in their home to recover in lieu of being in a government of Guam facility. When we put all those passengers that came from the Philippines under not a voluntary quarantine, but some of them didn't want to voluntarily go to quarantine. So with the powers that I have as a director of the Department of Public Health, I had to instill my powers from a voluntary quarantine to a involuntary quarantine. And having said that, I then have to let the AG know about this so that we can appear in court, because they do have rights, all these passengers, to appear in court to testify of they're not comfortable in terms of being in a involuntary type of quarantine facility. And so I appeared in front of the judge to defend my case with the AG, saying that the reason why they're in an involuntary quarantine is because the Philippines was a hot spot and we're seeing all the infection coming from the Philippine travel. Having said that, the judge asked me specifically, are there exceptions that are made for them going from a government of Guam quarantine site to being quarantined at home? And I said, yes, Judge, there are exceptions. The exception was we release some of these people that also had other health issues. For example, the ones that just came from St. Luke, they traveled, they're residents of Guam, but they traveled to St. Luke to seek medical treatment. And so we released them home for home quarantine. I also indicated there may be also behavioral health issues that the patient endures, and we release them to home quarantine. There are also other conditions. They may have comorbid conditions, or they may have a minor that, or they need a caregiver and so forth. These are all a lot of conditions that we also consider. And so the judge was very much aware of those, and I told her The other part of this is that we want to ensure also that the home is an appropriate place for them before we move them. And so with anything, if the home is suitable and the conditions are met of what our guidelines are for them to be in home quarantine, then that is possible. So again, the ability to make that decision lies on the Department of Public Health. My staff that work in these areas that are specific to surveillance and follow-up and contact and in the area of containment of the virus are in that situation to make that decision. And so the answer to that question is we can consider Ms. Matanani under self-quarantine. I know her personally, and I know the fact that she has a home and she's the only one in her home, and it's suitable because there's nobody else there, and she can self-quarantine for that time period. And we will allow that. We will take into consideration those special health conditions that do arise, as I mentioned earlier.
Thank you, Linda.
And she doesn't have to pay for self-quarantine, of course. But
Right.
the next question that I'm always asked is, what if they quarantine in the government entity or the government facility? Would the local residents have to pay? The answer is no. If they are non-residents, then we say to them that it will be the responsibility of the airline industry or the traveler.
Yeah, and the second question, the second part to that real quick was there any options to do rapid testing at the airport as these passengers arrive?
Yes, we don't have the rapid testing right now. The rapid testing that we have is the ABI IV now. There's another type of rapid testing with saliva, but that's the one that I'm talking about we don't have now. But as far as the ABI Abbott ID now, it's very specific that we want to make certain that it's in the point of care type of a facility. And I don't recommend it at the airport at this time because we have to abide through HIPAA regulations and also the contaminants and there's fumes that have to be in place so that any contaminants are removed appropriately. And so we need to examine that and to make sure that wherever that Abbott ID now is at, and we can do that. And so I hope that answers your question.
Thank you, Linda.
Thank you, Nick. I-94, Adriana Cotero.
Hi. So Linda, my question for you, during the oversight hearing, it wasn't clear whether your digital signature was authorized on the document designating the Pacific Star as a quarantine isolation facility. So can you just clarify or say, was your signature authorized on that document? Yes or no?
That's a question that when that happened, whenever they use any electronic signature, there's a policy in place where they have to give us a call. And I'll be honest with you, when I got a call, I get a call for a lot of things. And during that time when I got the call, I did not recollect or remember if that was that case. And so it's my take that the call was made to me, but I don't recall what it was specifically for at that time.
Oh, okay. And so, so I guess just to clarify then, so your answer for that is that you don't recall if your signature was.
Yes, that's correct.
Okay. Okay. Under the law granting you special powers during the public health emergency, are you in charge of the island's COVID response, which includes the procurement for hotel and quarantine facilities, or do you feel you should have been involved under the authority within the special powers you are given?
Yeah, in accordance to the special power that I'm given by 10 GCA Health and Safety Chapter 19 Emergency Health Powers, I'm prepared because I had a public hearing. I am designated to have that power for procurement. During this time of our response in the COVID, I am a line agency as a director of public health. And as we were journeying through for our response, we started procuring within our Department of Public Health to be prepared. We started as far as January, and I was procuring in terms of just within requisitions. We process requisitions through our department. And of course, that is done in our department, and those are the types of requisitions that I take, and then it is given, because we're a line agency, it goes straight to GSA, and then GSA prepares the purchase orders. So at that time, that's what I've been doing as I journey through the response for COVID. And we also procured within our department, in my area of focus, more test capability through diagnostic lab and other areas that we need help, like support from nursing personnel and so forth.
If I could real fast, but so those special powers, they give you as the director power over all agencies, correct, in response to the public health emergency?
Well, that's what the law says, and that's what the law is. So it is in the law.
Thank you, Adriana. And that will conclude our press conference for today. Thank you, Dr. Cabrera. Oh, I'm sorry. Ricky, did you want to add something?
Yeah, sure. Just wanted to clarify the question regarding the cash assistance payments. Just from the Department of Administration, they mentioned that there have been 500 checks that have been cut and released, and throughout the next week, they expect to be able to pay out the remaining amounts.
So that's for the program.
Yeah, that's for the cash assistance program. Yeah, that Linda has been able to read much more eloquently than me.
That's with the SNAP, the programs, the other government programs. Yes.
Oh, the other
So I
government.
hope
Okay.
that clarifies things.
It's the program.
Yeah. So no changes.
Yeah, the program Salapi, right.
So 500 checks cut for that. And there's no date, Ricky, in terms of the changes for the unemployment programs applications?
Oh yeah, you know, I would defer to Dave De La Sola on the timelines, but from our obviously we work together on that program. But in terms of date and timeline for the online application, I believe he's working diligently on that.
Okay.
I'm sorry.
I know that there was a date of like May 15th was the date, or May 14th was the application.
Okay, if that's what he's saying, then I defer to him. But I know that the process of training the employees that have been transferred from around the government, and then also the hiring of the standing employees that will be trained by the employees that are currently being trained, as well as the call center being stood up, as well as the online application being tested, and then training for the online application, training for the claims inputting, as well as the eligibility. I think they're also discussing the determination, redetermination, and appeals process that requires obviously a lot more work. They continue to work with USDOL, who is actually conducting the training via webinars, live webinars with those USDOL technical assistance people. So there's a lot of work concurrently going on, and I know that Dave is probably the best one to answer in terms of timeline. But that continues to be a main priority of Dave, Guam Department of Labor, and as well as the administration.
Thank you.
Thank you, Nick. And again, that concludes our press conference. Thank you, Linda. Thank you, Dr. Cabrera, and thank you, Dr. Hernandez.